lab this week we are going to be covering the shoulder evaluation. So when the patient first walks into the clinic, I want to make an observation. I can either do it from the anterior aspect, the lateral, or the posterior view. For video purposes, I'm just going to show the posterior view. So some of the things that I look for in my patients are whether or not their shoulders are even. So you can see Cole is slightly depressed on the right side. I'm also looking at the musculature to make sure that there isn't any noticeable atrophy comparing one side to the other. While the patient's in this position, you could also take a look at the cervical spine, thoracic, or the lumbar spine as well. After I've made my observation, I'm going to move into the bony palpations. So the first is going to be the sternum and the sternoclavicular joints. I'm actually going to have you turn around. So starting right where the clavicle meet on the medial side is going to be the start of the sternum. So I'm just going to palpate all the way down. Where the sternum and the clavicle meet is the SC or sternoclavicular joints. I'm just going to palpate right in there. From here, I'm just going to walk my fingers laterally along the distal end of the clavicle. When I reach the end, I can palpate the acromion process. If I walk my fingers down a couple centimeters right in here, I can feel a bony block. That's the coracoid process. Here I have the humeral head, just lateral to that. And then, of course, I have the humeral shaft all the way down. Remember, on the humerus, there is the greater tuberosity and the lesser tuberosity. So remember that the biceps tendon splits right in between those two. So if I'm having a hard time palpating it or finding where to palpate, I'm just going to passively bring the patient into internal and external rotation to feel the biceps tendon. Good, so go ahead and relax. So his biceps tendon is right here. If I walk laterally to that, that is the greater tuberosity. Back on the biceps tendon and walking medial, that's the lesser tuberosity. Remember, the transverse ligament holds the biceps tendon in place along the two tuberosities. I'm going to have you turn around again. Good. So on the posterior aspect of the shoulder, we of course have the scapula. So if I'm walking my fingers along the medial side of the scapula, that's going to be the medial border. There's also the axillary border. Axilla is another way to say armpit, so I'm just kind of along the side that faces the armpit. We have the superior medial border of the scapula. We have the inferior medial angle of the scapula. The vertebral border is also known as the medial aspect of the scapula, if you want to use those interchangeably. And then of course the axillary border, how I talked about before, right into the armpit here. So those are all that we have for our bony palpations. Next we have soft tissue. So I'm actually going to have you turn around one more time. Good. So the first is going to be pec major. So remember, pec major kind of fans downward like this. So I'm just going to start the most lateral and superior. And then you can just slightly work your fingers downward. Next we have the biceps. Remember, the biceps tendon sits right in between the greater and lesser tuberosities. I can palpate the biceps tendon and walk down into the actual biceps musculature. Remember, from anatomy, the coracobrachialis is just medial to the bicep muscle groups. So I'm just going to walk slightly medial to the biceps. We have the deltoid musculature. So we have the anterior, middle, and posterior fibers. So I'm just going to differentiate those. Walking my fingers anterior, lateral, and then posterior. We have the serratus anterior, so remember those are the muscles that sit just along the rib cage. So I'm going to have the patient up against his shoulder like that, and then I'm just going to follow the musculature along the side of the ribs here. As I had mentioned before, the transverse ligament cuts across the tuberosities, holding the biceps tendon in place. So I can just palpate here. Again, if I'm having a hard time locating that, I can passively internally and externally rotate the patient and find that biceps tendon snapping underneath my thumb. I need you to turn around again. For the posterior musculature, we have the levator scapulae, so that's just going to be right along near the upper trapezius. Next we have the latissimus dorsi, so remember that kind of fans upward and attaches onto the humerus. So you can start distally and then just walk your fingers up. If you wanted to here, you can palpate the rector spinae musculature. On the back side, remember we also have our rotator cuff musculature, so if I wanted to palpate that, I'll start on the actual scapula. Above the spine of the scapula is the supraspinatus. Below the spine of the scapula, we have the infraspinatus. We have teres minor, and then the most lower aspect of the scapular musculature is the teres major, so that's going to be kind of right in here. Next we have the rhomboid, so we have rhomboids major and rhomboid minor. Remember, rhomboid minor sits on top, so that goes from about C7 to T1 down into the medial border of the scapula. And then T2 to T5 is going to be rhomboid major. That's just right in here. Again, inserting on the medial border of the scapula. And then lastly, we have the triceps musculature. So that's just going to be on the posterior aspect of the arm here.